What about self-care for the care partner? Why is that so important?
Feel like this is such a hard thing for people because it always gets put on the back burner. And I know a lot of the times it's like when you're on an airplane and they say, oh, put your oxygen mask on yourself before you put it on anyone around you, because you can't help others if you're running on empty. You really need to take care of yourself. Make sure you're not just, functioning, that you're eating and sleeping and hydrating and taking care of all your own personal needs, but also that you're taking time for you to kind of reflect and have some time to decompress from everything you are trying to do to help your family member or loved one.
Why should care partners speak up and ask questions about how they're taking care of the patient, what they can do to help the patient and themselves?
Yeah, I think that these bispecific antibodies are new, and one great thing about them is that overall they are really well tolerated in general. So hopefully it means the patient is feeling pretty good and having a really nice response to their therapy. But if they're not feeling good, we want you to speak up at home. Again, sometimes patients are the last person that want to tell you there's a problem because they're worried about missing their therapy. And I always tell patients it's sometimes not safe. If you do have a cough, if you had a fever, we want to be safe and maybe hold a dose of therapy to address maybe something else that's going on and avoid further complications, in another week. So if you're noticing something, I always encourage people to speak up and let us know of any concerns they're seeing at home.
Alexandra, during treatment, are there any lifestyle changes that need to be made? Like diet, for instance?
No, I mean, a lot of patients definitely want to maximize anything they can do to make themselves feel better and help their myeloma respond. I've seen is that there's not one particular diet or cutting out one particular food that's going to make a long-term or significant impact on any cancer therapy. The best thing that you can do in terms of diet or lifestyle is to try and just maintain a healthy lifestyle to balance all your other medical needs. You want to make sure your blood pressure is in good controls. You want to make sure if you have diabetes that your blood glucose is in a good range, because having those things be in good control is going to make your therapy and potential complications more manageable.